Okay, thank you. So my name is Phoebe Stapleton. I'm an associate professor to the Ernest Monroe School of Pharmacy and the Pharmacology and Toxicology department there, and a resident scientist in the UHSI building, so part of the center here today. So thank you for that. It was great talking on a lot of introduction of the concepts and the problems I think that we're having, and want to give you just a little insight, I guess, about what we're doing at Rutgers to try to understand some of these outcomes and understand some of these problems. So I'm going to talk to you about micro and nanoplastic exposure during pregnancy and how we got to some of these questions to start. So my background is in air pollution and looking at particle effects after inhalation. And interestingly, the epidemiological evidence doesn't have a direct association with respiratory outcomes. The association after inhaling these particles is actually with cardiovascular outcomes. So we originally wanted to try to answer that question. How is it something that's inhaled can affect the cardiovascular system, not the respiratory system? It's not very intuitive. And that cardiovascular outcome can come within 24 hours after exposure. And during pregnancy, if there are exposures that take place, it actually leads to an increased risk of fetal growth restriction in those moms. So overall, we can understand from these epidemiology studies that exposure to air pollution has these cardiopulmonary health effects, really adverse health effects. So understand the mechanisms why. And part of those mechanisms is associated with the size of those particles. So Matt did a great job of trying to give some kind of clarity to these just inconceivable numbers or sizes that we'll be referring to. And so one of the things that we've learned is that the larger particles can get into the lung, and they have these beautiful clearance mechanisms where they're able to get cleared back out of the lung. They don't necessarily get that far, and then we're able to clear them either by coughing them up or swallowing them. But the concern is with these smaller particles. So these are in that nano range that Matt was referring to. So these are nano-sized particles. And they get deeper into the lung, they get into the alveolar region, which is where the gas exchange takes place. And so because of that, they can stay there. So they have a greater propensity to stay within the lung. That can lead to greater inflammation locally in the lung, also systemic inflammation. They've been shown to have neurological implications. And even these particles can then translocate and have been shown to leave the lung and are found in different organ systems farther downstream. And so overall, this exposure to those ultrafine is what they're called in particulate matter or air pollution studies, and often we refer to them as nanoparticles as well because they fall within the same size range. So it's really just all about how they're made, but what term you should be using. So these ultrafine or nanoparticles have greater toxicity than their larger micro-sized particles, and that'll come into play as we're thinking about micro and nanoplastics as well. So overall, we know that these nano-sized particles have this greater toxicity. My area of interest is really in maternal-fetal physiology and maternal-fetal connections. So this is a complex and widely understudied model. Matt made a reference to the placenta earlier, and he called it kind of a throwaway organ. So I appreciate that from the clinical sense that you have it and it's not the important part when the baby comes out, so you just throw it away. But at the same time, if it weren't for that organ, none of us would be here at the same time. So it has incredibly valuable clinical relevance. And so with that, it's also a naturally forming, very transient organ. So it gives us a very clear kind of time shot of a woman and a fetal life during that development. So what's happening during that time? So we also know that there are physiological disparities during pregnancy. There's an increase in blood volume, there's an increase in heart output or cardiac output, and there's also an increase in tidal volume. So a woman who's pregnant doesn't take more breaths necessarily during the pregnancy, but the breath that she takes is deeper. So she's getting an increase in exposure from that air already. And then there are outcomes like this fetal growth restriction, and if a baby is diagnosed with fetal growth restriction, that has increased diagnostic outcomes later. So we have an increased risk of morbidity and mortality, and then if they are to survive, or when they are to survive, they also have an increased risk of cardiovascular disease, neurological disease, metabolic disorders like diabetes, metabolic disease. So our research question was how something that a mother can inhale during pregnancy, a particle, how does that affect her health, the fetal-placental interface, the fetal health, and the health of the offspring as well, if they were to survive to that F1 generation. So we created this laboratory model, and in our laboratory we use a rat model, and so we expose them in our inhalation facility that's over in the UHSI building. We put our animals into that inhalation facility, and they breathe these particles in. And we do a wide range of different methods to be able to assess the concentration that they're exposed to. We monitor heat and humidity to make sure that they're comfortable and that they're safe in there at the same time. And we also measure the size, because if you come from a nanotoxicology background, you have to prove you're doing nanotoxicology work. And that means a particle that's less than 100 nanometers or smaller to be in that nano realm. So we spend a lot of time and energy making sure that we're proving that we have nano in our exposures. And so from these, we've answered a bunch of questions as it pertains to this air pollution and ultrafine idea. But what we realized is that we had a lot of internal outcomes. We know that the vascular system doesn't work as well after exposure. We know there's an inability to meet this fetal blood flow, that leads to fetal growth restrictions. And there's issues with the postpartum recovery as well. And we saw our fetal and our offspring. We know that there's cardiovascular disease implications for the fetus and with the surviving offspring when they grow to adulthood. But what we didn't consider in some of these original studies was this placenta in between. So we have this big black box that's in between, but clearly the conduit between the mom and that developing fetus. And so we had some questions there in that, are these maternal and fetal outcomes that we're seeing, is that just associated with the exposure and the changes to the mom and her physiology, and that's what's leading to all of these outcomes? Or is it actually a direct particle interaction? So the question that we actually got was, if these particles are getting across the placenta is thought to be a very clear biological barrier. It's keeping all of the good things in the fetal side and the bad things on the maternal side and allowing for this nutrient waste exchange. So what about these particles? Are they able to get across as well? So we developed a technique to be able to look at this, where we were able to take the uteroplacental unit out of a rat. We were able to actually cannulate on the uterine artery, and this allowed us to, and the umbilical vein, we were able to, or umbilical artery, sorry, we were able to cannulate as well, and that allowed for this cross-flow design through the placenta. We could then put our particles in that umbilical or uterine artery, up here, and then we could measure the effluent that was coming out. So the fluid that comes across that uterine artery and the fluid that comes across the placenta and comes out in this umbilical vein. And so we put some of our nano-sized particles in there, and we did a time course study, and we were able to see those particles coming across that uterine artery within about 10 minutes. And interestingly, we were able to see those particles also coming into that fetal effluent, into that umbilical vein. So that's going to dump directly into the fetal liver. There's a shunt that's there that prevents a lot of it from staying in the fetal liver, and instead it just goes directly to the fetal heart, and of course then it's sent all through the system. And so what we see is that those particles are actually there within about 90 minutes in that fetal compartment, and they stay coming out in a significant amount throughout about 3 hours, 180 minutes. And so this was kind of our trigger point, actually, when it comes to micro-nanoplastics. I think everybody in this room has had kind of that moment all of a sudden where we realized that there's a problem, because we were using polystyrene beads, 20 nanometer size polystyrene beads. So it wasn't just that I was using nanoparticles, but I was using nanoplastics as well. So it's not just that the nanoparticle gets across, but it's actually nanoplastics that are getting across into our system. So we've all had that aha moment. And we're very aware, since we're all in this room, that we're surrounded by plastics. Some of those inconceivable numbers that I was referring to is just the amount of production. So we live in New Jersey. We're familiar with the traffic that's on the New Jersey Turnpike, I think, and just the amount of cars that are passing through. There are actually 205 million cars that pass through the New Jersey Turnpike in 2023. In 2023, there was also about 430 million tons of plastic that was produced worldwide. So that's enough. If you consider each vehicle, that can be a smart car, that can be an 18-wheeler, what have you, you consider each of those vehicles as a ton of plastic, you're talking about just over 2 years of traffic on the New Jersey Turnpike of vehicles as 1 ton. It's about 2 years of worth of traffic is this 1 year of production. Now that's supposed to exponentially increase by 2050, as we've heard before, to about 580 million tons, and now you're talking about just under 3 years. I did the math earlier. It's 2.89 years of cars will be produced in that 1 year in 2050. So it's really, really difficult to get some kind of mental ability to understand how big, or in some cases in our work, how small these things are. That's the best I could come up with of how to indicate how much is being produced. So we talked about that life cycle overall. So we know from Rob's talk earlier, plastics are made of this polymer. The breakdown of plastics, no one's really been around for those, 1,000 years to break down the bottle, or 450 years to break down a Coke bottle, for example. So this concept of decomposition is really unclear. And it seems to be that the decomposition isn't necessarily referring to the chemical degradation, taking a polymer and returning it back to that monomer, but actually referring to particle size. That it takes that bulk particle, bulk product, and gets smaller and smaller and smaller. So we have microplastics then forming into nanoplastics instead. And I find that really important because just because something is invisible doesn't mean that it's not there. So if you haven't seen this YouTube, and I can provide the link later, but a scientist took the Coke can and put it in one of the acids and bases that Matt was referring to and got rid of all of the aluminum on the outside of the can. And interestingly, there's the plastic liner on the inside. So just because you can't see it, that's how I think of these nanoparticles, doesn't mean that it's not there. So here's the size definition. I think Matt did an excellent job of having a visual of what these are. So we're talking about something within the COVID size range. We're all aware of how difficult and challenging that was to avoid, even with a number of different masks and all of those things. So we're talking about something within that same size range based on the images that he produced earlier. And we know that they're in the environment. They had not been studied very well or thoroughly characterized because it was a challenge. It's a chemical challenge to be able to do this. They look like organics. So they look like soil and other things or fats that we expect to have there. So they're not as easy to be able to measure as they are with the metals and some other contaminants that we're more aware of. And yet they've been found in all of the national parks and the waterways. I don't think we need to go into all of the areas that they've been found. So we have this ingestion route, inhalation route as well, that have these micro nanoplastics in them, even things that are supposed to be organic, like honey or rice. And it's especially concerning when you consider indoor air, given the amount of time that humans now spend in an indoor environment at the same time. So we look just in the room here, we've got the carpeting, the chairs, the cover on the table, many of us, some of the clothing that we're wearing. So consider how much time we're spending indoors for those indoor exposures. So here are all of the tissues that they have been found in humans so far. So we're looking at the human lung, both patient and cadaver, carotid artery bulb, olfactory bulb, which is just under the brain, heart, lung, liver, kidney, urine, penile tissue, testes, breast milk, placenta, and meconium. And I have a star with placenta, meconium, and really breast milk should have a star as well, because these are, as well as urine, these are all naturally occurring substances. The others came from human cadaver or patients, which means that they died of something, and they also had a disease state of something. But I'm really interested to allow for the surgery, but I'm really interested in some of these more naturally occurring tissues, like the meconium. That's the first fetal bowel movement that takes place generally in utero or shortly thereafter. If that was found in the fetal meconium, the only place that the fetus would have been able to get access to those plastics is through the umbilical cord. And so that's part of our area of interest. We were also part of the study that highlighted the nanoplastics in the bottled water that came out in January. And part of that is just to be able to show the capabilities of how we're studying these, how we're looking for these plastics and being able to find that nano size range. So we went back to our laboratory model again, looking at those maternal and fetal outcomes. So we had an exposure where we would expose the mom, either through the lung or the GI system, and then we would have that go through the umbilical cord and we'd look at the fetal tissues. And what we did was we looked at the fetal heart, lung, liver, kidney, and brain of those developing fetal pups to see if we could find those plastics after that single maternal exposure 24 hours later. And so we used a technique called hyperspectral dark field microscopy. So this is a very fancy way to say that we look at refracted light. So if you've ever taken a flashlight and kind of wondered what a noise was in your backyard and you stand around, you saw eyes glowing from the other side, this is how I think of this hyperspectral dark field microscopy. Because it's the light refraction coming off of the particle. But it's also a very specific fingerprint of that particle as well. So we understand what the wavelength is that's refracting back or bouncing back off of our plastic. And that identifies that it is indeed a specific type of plastic as well, as opposed to this white that has the background. And so when we see that in the visual image, we see these white spots or white stars throughout. Okay, so that's what we're going to be looking for in our tissues. And when we do this exposure, we put our particles into the lung of the pregnant mom. we see that we can find these polystyrene beads in the liver of the fetus that was developing within the mom. Not only do we see those particles in the liver, we also see them in the fetal lung, we see them in the fetal kidney, we see them in the fetal heart, and we see them in the fetal brain here after that maternal exposure, and just 24 hours after that maternal exposure. After that, we did a very similar study looking at lavage and ingestion of these particles, similar dose, similar study, similar particles with polystyrene beads. And what we see again is the particle translocation from the mother exposure to within 24 hours. You see those particles within the placenta, within the fetal heart, within the fetal kidney, and within the fetal liver as well. So we were wondering if this was just a point in time, that we know that they're in the fetus, but are they in the offspring after birth as well? So we worked on another study, and this work was primarily done by Dr. Morena, who's in the audience, in the gray jacket over there in the middle. And so what they looked at were these particles, looked for these particles using that hyperspectral dark field microscopy in animal tissues at 2 weeks of age. So these are animals that were exposed via our inhalation facility. The moms were exposed. The pups were exposed in utero, essentially. They delivered and they grew up for 2 weeks. At that time point, we looked at their liver and we find our polyamide, in this case, polyamide particles. We find them in the offspring lung. We find them in the offspring kidney, the heart, and in the brain of these 2-week animals as well. So this work just came out in August and we're really proud of it. The next component that we wanted to know about, though, was 2 weeks. They're still feeding from the mom, and it's been shown to be in breast milk as well. So there's a chance that these exposures are just based on that lactational exposure. So what about even farther out? What about when they're their own individual rat in this case? So about 3 months of age, they're considered sexually mature, they're their own animal. We use them for other things for the most part. And in our preliminary studies, when we look at our male and female animals, these particles are still persistent at that 3 week of age. And we know that these are the particles that we put there because of the chemistry that we put them in. We have them exposed to a very specific food grade polyamide chemical that's not used in our laboratory, it's not used in our animal facility, so it's very specific to this exposure, which means there's very limited cross-contamination between our control animals and our exposed. Our exposed have this very specific plastic in them, and that's what we're looking for. And we still see it in the liver, in the heart, and in the brain of these animals at 3 weeks of age. So it culminates to not just are we accumulating them in our bodies during our own life choices, but that we might also be accumulating them during the gestational time as well. These might actually be born. The particles might be in us when we're born at this point. So we have some ongoing projects here at Rutgers. Some of those are to understand the dosimetry between the exposure dose and that internal dose. How much is actually in that liver? When we want to do the toxicology on it, as Matt pointed out, we need to know how much to be able to give our animals. So to do some of our studies that are just on cells, we need to understand that dose. So if I put a known amount in on the front end, and the exposure science is working and figuring out how much humans are actually exposed to, then I'll know the dose I should put in on some of these downstream tissues. We want to understand the mechanisms of the transfer and the uptake. How are they getting across the placenta? How are they getting across the lung as well? There's some questions. The systemic toxicity, we know that they're in all of these organs, but what are they doing there, if they're doing anything? And then the specific toxicities based on the different plastics. So we've heard a lot about those conversations already, talking about vinyl chloride, talking about styrenes, talking about other things. These are each different chemicals, which all are going to have different toxicities. So is polyvinyl chloride more concerning or more dangerous than the polystyrene, for example? And so with that, I'd like to thank my laboratory that's here at Rutgers. Some of them are in the audience as well. Thank you all for listening.